start and we'll just do some general. Oh, that is some really thick fascia. Here's 3. Okay, good. I don't actually use, I usually just use lotion in the clinic, but we're going to use this today. So a lot of times they'll be sore right on we'll do the lateral right now, right on the lateral epicondyle, but I don't necessarily want to go in and dig in there right away. I might towards the end if we're just not getting someplace and I gotta like do some friction and free it up. But I'm always
5 seconds.
All right. Trash, I'll just put it right here.
Oh, thanks.
Is it supposed to be like a solid mass like that and just move on its own? Mind of its own.
It's actually really like kind of dried out. But so I'm just going to do some general, and I'm going to get an idea of just how her soft tissue feels. Okay. So let me do that for a little while. Okay. And then I usually kind of come in here. I don't want to like be really thummy, but I want to kind of feel where I feel some restrictions. Okay. So even though we get tightness here, it usually stems because things are tight more in the muscle bellies too. So if we start there, it's going to be a little bit less painful for them, and it might actually free this up without you going on it. Because if you go right over that tendon on the epicondyle, you actually can make it worse instead of better. Okay, and then we have all these muscle bellies in here, so you kind of want to get in between the muscle bellies. Okay, because sometimes that fascia gets caught up in there. And then we know
It's a great thing to do before you do those joint holds.
Mm-hmm. And they get used to your touch. You're assessing the tissue, how sensitive they are, how you're watching how guarded they are. And you always want to come up above that epicondyle because we have that extensor longus up there, right? I want to call it the hallucis, but that's not right. Our big toe. Yeah. Okay. So we want to go all the way through there. Then you can actually do some technique where you get both sides at the same time. Okay?
Like wringing it.
Just pull it straight on there. Okay. Bring it here this way. Go that way. So if I'm using my thumb here, I'm not using my thumb. I'm still kind of using a lumbrical grip, so I'm still using the side of my thumb. The lumbricals are gonna have a lot more endurance than like your finger flexors. So. And it's going to be more comfortable for the patient than that, right? Mm-hmm. Occasionally, you got to get in there a little bit deeper, okay? So you can try that. Okay, so then when we're talking about pinning and stretching, actually, I probably would do the pinning and stretching more seated, but we're going to just do it here. So what does that mean to pin and stretch? Anybody?
So you hold down and then you stretch passively?
Yeah, you can do it active or passive, okay? So basically, if I feel say I felt a restriction right in here, okay, I'd want to go before that and kind of hold it down, okay? So you can do it, you can hold it here. If I was on this side, I can hold it here with my light fist, okay? So basically you're acting as a strap. You know the straps that you put around it, but you're acting as a strap, and then I can have her go ahead and do some wrist extension, okay? And that way I'm creating a barrier. She's not going to really notice a difference because say it was painful for her to extend, but I created a barrier between where the pain was and her extension. So now I can have her extend without any pain. So you can use this on the traps. You can use this on the hamstrings. Hamstrings is a great place to use it because we talked about not, so you're going to have her come up. And then I'm going to have her go all the way down into a stretch. So that's more of the pin and stretch. But I usually like to do active first just to make sure it's okay. So we're going to stretch. So on the hamstring, we talked about not stretching a hamstring that was strained, but if it's like if it's a proximal strain, and I pin it like before the ischial tuberosity, then I can stretch the hamstring and not cause that pain, okay? So we'll have our stretching too, okay? So I usually start going the way towards it, and then I'll go away from it and make sure we're not getting any of her normal pain, okay? So you can do this.
So how much pressure you have here? You're saying that you're restricting the pain that's able to move?
A decent amount. It's a pretty firm hold, right? Mm-hmm. Yeah. Because I got to pin it. So think of pinning it. So basically I'm pinning the muscles down to the bone, basically. I'm restricting any movement there. So that when she stretches, the stretch stops at my finger and doesn't go up into the lesion. So I'd have to have found the lesion first with my soft tissue work. Okay? All right. So then we're going to talk about passive and active release techniques. Just so you know, ART is active release. You cannot use the term ART unless you are ART certified. Okay? But you can say you're doing a release with active range of motion. You can say that, but ART itself. So you can't say you're an ART therapist or you do ART. If you have not been, they have it trademarked. Just so you know, in your documentation. Okay. So, so we're going to take her into full. We're going to shorten the muscle completely. Okay. So we're going to supinate. We're going to supinate and extend. That shortens the extensors, right? Okay? And then we're going to massage, and I can do it passively, okay? And I can move my hand, or I can just hold it and have it move underneath her. Okay, and then I can start having her do it. Can you go ahead and do that same motion? So usually I'll take her through it first, and then I'll have her go through it. So again, this can be used on any muscle. You shorten it, and then you actively or passively fully lengthen it. Or active assistive works too, okay? If I want to go a little bit deeper, then I can come here, have her do that, okay? And then I can have her bring it down. Okay, and then we can go real. So that's kind of what we were doing, like on the psoas too, right? We had them extend. They had to flex too to get there, but then we had them extend. Okay, so you could do the same thing here, where you would shorten it. So how are we going to shorten those flexors? We're going to pronate. No. Yes. Pronate, and then we're going to. Okay. So we're kind of doing active assisted right now, so I'm guiding her through the motion, but I'm letting her move it. Okay? You don't want to go too fast because you want to kind of just hold there and let her slide. Then they like it a little bit because they have a little bit of control. Okay? I probably would be better off if I had a little towel here so I don't have her shoulder. But sometimes you just got to play with that depending on what you're seeing. I like the position of her shoulder. Okay? Okay. So active and passive release and pin and stretch. So those are just some techniques that you can use on basically any muscle. You shorten it and then you have them lengthen it as you are holding that spot. And you can use it on, you can go through different spots on there. Okay? Try that.